Hello everyone, I am Dr. Pradheep Rachakonda. I am a consultant cardiac surgeon at Continental Hospitals, Hyderabad. So today I am going to discuss briefly about something which most people would have noticed, but at least I have wondered when I was a kid why that was happening. That is, people during walking or when they are playing, some people suddenly collapse. They hold the chest and suddenly collapse. Is that possible? Why does that happen? And secondly, some people go to sleep and never wake up from the sleep. So what happened? Why are they not waking up? They pass away during the sleep. So what exactly is going on? So if we look at it this way, what we call coronary artery disease is going on in both of these scenarios. The only thing is, in both scenarios, the patients did not have any symptoms beforehand for them to know that they have something going on in the heart. So one fine day when the damage happens, then we see the end result, and we call that silent MI or silent heart attack. So what exactly are silent heart attacks? Silent heart attacks are cardiac events that happen without any symptoms either at that time or there were no warning symptoms beforehand. So that is called a silent attack. So we see that more often in people who have long-standing diabetes and very elderly people like more than 80-85 years, and people who have previously undiagnosed coronary artery disease. So why does that happen? See, normally people who have diabetes, they also have coexisting neural disease, what we call neuropathy. So normally when the blood supply to the heart gets cut off or reduced, they develop some symptoms what we call chest pain. Chest pain, either it also moves to the left shoulder or left ear. They can have it either during increased activity like sports or running, etc., or they can have it even at rest. So people, when they have this neuropathy, they do not feel the pain. Absence of pain does not mean everything is normal. The cholesterol deposition and the narrowing of the blood vessel and the blockages, they are all happening inside the chest, but they have no way of knowing because there are no warning signs, because the nerves that normally conduct this pain sensation is damaged. So these people, suppose they are going on a walk or they increase the cardiac activity like the sports like badminton, shuttle, etc., the heart pumps very fast, and for that, when the pumping is happening very fast, the demand increases, but the blood supply does not increase proportionally to the increased demand because the blood vessel is narrowed. Only 50% of the blood vessel area is there where 100% blood used to be carried. So the heart is not able to increase the blood supply in proportion to the increased demand. At that time, any cardiac event can happen, and that is why some of you might have noticed people who have gone for fast walking or jogging, suddenly they clench the chest and they collapse. If they are fortunate enough, they can be revived, taken to the hospital, and they can be saved. Sometimes they have a massive heart attack and they cannot be saved at any cost. That is because if one of the main blood supply to the heart, the left side artery, it supplies around 70% of the heart. If that blood vessel gets blocked, then 70% of the heart gets affected with no blood supply, and the 70% of the heart, the muscle dies. That is a massive heart attack, and the person is at risk of losing his life immediately. So how do we come to know that you have heart problem? The only best way to know is to do a regular annual or once in 2 years cardiac checkup and find out if there are any issues with the heart, so that you can take appropriate preventive measures beforehand. The same thing applies for people who don't wake up from sleep also. They can either have a heart attack during sleep, which is big enough for them to lose the life, or in very elderly people, the conduction system of the heart gets disturbed, so that the patients can have what we call arrhythmias. Instead of the heart beating regularly, they can have irregular arrhythmias. They can have ventricular tachycardia or fibrillation, and the heart may suffer a cardiac arrest. So these people pass away during sleep and they never wake up, which uh, common people used to say it's a lucky way of dying. But either way, the best solution is always prevention rather than treatment after an event happens. So those who are over 35 years of age, especially the Indian population, due to the current dietary habits and the lifestyle patterns, we see more of these coronary problems at a very young age as compared to 2 decades before. So once in 1 to 2 years, all young people should have a regular cardiac checkup, just to identify if they have any ongoing cardiac problems. We will get an ECG, echo scan, a treadmill test, and if needed, any coronary angiogram. That way we will come to know if there are any cardiac problems, and we can take appropriate preventive measures for that. Thank you.